Welcome back. This is Matthew McKenzie, care activist, volunteer of Carers UK and network partner of Carers Trust. I'm also involved in quite a few other things. And one of the things I'm involved in regards to, let's say, Signet Healthcare, to be honest, I'm now the PCREF, Carers Lead. And I've been involved in PCREF for a while. And sorry for those who don't know what PCREF is, I'll explain it. You might actually have a look at one of my previous videos on PCREF. One could just say framework. That PCREF actually stands for Patient Carer Race Equality Framework. It's one of the recommendations that's coming off the back of the revamped Mental Health Act. But even before the Mental Health Act, even going way back past 1983, there has been health inequalities, and this is the main focus. Not the only focus, I suppose, when it comes to lectures on this thing. So we'll be doing a lot of videos regarding health inequalities and the impact it has on minorities. So this lecture actually um, is heavily linked to the NHS England's patient care race equality frameworks, especially on health inequalities. And it goes in beyond that, to be honest. But one of the things you might find is when someone mentions minorities, and not just ethnic, it's the global community, it's LGBTQ plus, um, traveler, travelers, even white people, to be honest. When I say travelers, I'm talking about traveling community, um, those from different regions of the country. A lot of it will, on this lecture, will focus on minority groups, though, and I will revisit other um, health inequalities or discriminatory practices when it comes to health and well-being. You might find the title, though, a little bit odd because it's saying the proof is in the pudding or just the facts, ma'am. And this is basically why I decided to do a video on this, because the problem is what I've experienced again and again, you know, I've noticed every so often is that when you do mention health inequalities regarding minority groups, there'll be always be someone saying, well, no, they're all the same. No one's been discriminated against. But the reports say different. And there are a lot of reports. And this is what I'm going to present today in this lecture. Only half of them, because there's many of them. And something oddly enough, well, I wouldn't say oddly, I run or facilitate the National Ethnic Mental Health Carers Group. And organizations I'm about to mention regarding these reports often visit or collaborate with that group. And there's some heavy hitters, and we are still collaborating. And if you look closely, there might be stuff that they're doing in the works, because at the end of the day, I think a lot of the organizations are just sort of getting a bit tired, and people in general are getting a bit tired. Well, let's have a look. I won't sort of point out what stuff I'm working on. I might hint it. We'll start with the NHS Race and Health Observatory report. And I think what I've noted here is there's a lot of focus on mental health and maternity care, especially when it comes to Black people. And remember, the reason for this lecture again is that there'll always be someone out there saying, well, you're just saying that in regards to health inequality. You've got no proof that minorities are being heavily impacted by this. So a lot of these organizations will go away and measure health and trying for a lot of resources to prove things are the way they are. And this is fairly recent. The key finding of this report, 2022, it looked at the significant ethnic disparities across a wide range of health services, including mental health. I do remember I'm talking about the situation of the Mental Health Act being so old, 1983, being revamped. Maternity care and primary care. So that was the key findings of this report. I didn't link it properly. I should have put it in red. But anyway, Black adults were more than 4 times, that are put in bold, more likely to be detained under Mental Health Act compared to white adults. Ethnic minorities also faced higher rates of coercion, including being restrained, put in seclusion. Distressing key findings, to be honest. Do remember again, my background, mental health care is mental health. Again, this is one of the things I felt was important to present on. But it's not just mental health, it's maternity care, because the things it found in that report, this is the NHS Race and Health Observatory, it found that in maternity care, Black women were 4 times more likely to die during pregnancy or childbirth than white women. And Asian women were almost twice as likely to die. Let me move this cursor out the way. But it's not just maternity care, we've also got primary care access. So ethnic minority patients reported difficulties in accessing GP services and receiving referrals, further tests and treatment. Because of all of these things, obviously it's like a trust. Ethnic minorities were more likely to feel mistrustful of healthcare services, which often stems from historical and ongoing experiences of discrimination and poor quality care. So that's the first organization that I mentioned that every so often will attend, the group that I do will link in and report. So this is the first of many reports, really. This is what they found. We'll go on to the next one because I want to try and keep things fairly brief because sometimes my lectures can go on a fair bit. But the next one, Public Health England, and their report was, and this was a big one really, the impact on COVID-19, review of disparities in risks and outcomes. And I still say fairly recent. This obviously I've labeled it red this time, so I've done it properly. So this report actually demonstrated how COVID-19 pandemic disproportionately affected ethnic minority groups, exposing underlying health inequalities. So there was always a problem with health inequalities, and the key test was if a pandemic did happen, which it did, how did it raise? How badly was those who are vulnerable affected? And now a report had to come out, and I think there's an inquiry still ongoing regarding this, or a push for more of these inquiries. So the mortality rate is the litmus test. Death rates from COVID-19 were significantly higher among Black, Asian, and minority ethnic group. BAME is not a term that's likely to be used much anyway. And those groups compared to white groups, Black men were 3.3 times more likely to die from COVID-19 than white men. And Bangladeshi and Pakistani communities were twice as likely to die from the virus. So think about that. Again, Black people, minorities disproportionately affected. The socio-economic factors, the report noted that ethnic minorities were more likely to be in the frontline jobs, such as healthcare or transport. Remember the buses, when people were getting on the buses and they had COVID, then obviously on the front line, you're going to get that. Thus, they also live in overcrowded housing, experience greater socioeconomic disadvantage, all of which increased the vulnerability to COVID-19. So this was, if there was a disadvantage before, COVID-19 was a litmus test of that. How badly would this impact those on the front line, those who weren't supported as well and kept in situations that made them very vulnerable if they weren't vulnerable already. So the bit Public Health England also highlighted in this report was the report highlighted that systematic inequalities in access to health services. The report also highlighted underlying health conditions and quality of care contributed to these disparities, a word a keyword you'll often find in these reports. So that's the second report, and there are many. Some I can't obviously put in the lecture, gone for quite a while, looking for key reports. Next one's the Marmot Review, Fair Society, Healthy Lives, 2010, 2020, and their updates regarding this. The key finding in these reports is the original Marmot Review, followed by its 2020 update, explored health inequalities across the UK, which focused on how deprivation, ethnicity, and other social determinants of health affect life and I put that in bold, expectancy and overall health outcomes. From that, lead on the life expectancy gap. So ethnic minorities, particularly Black and South Asian populations, face lower life expectancy and higher rates of chronic conditions such as heart disease, diabetes compared to white populations. Social determinants, the review emphasized that ethnic minorities are disproportionately, and I've made that stick out more, affected by poor housing, low income, unemployment, and education disparities, which is something I will present on at a later date, which contributed to long-term health inequalities. And this is before when the pandemic hit. Now, moving on to COVID-19, because I keep jumping ahead because I'm not presenting, I should just slow down a bit. The 2020 update found the inequalities in health had worsened over the decade, which ethnic minorities groups facing greater hardship and health risks during the pandemic. Next one is the CQC. Again, the good in engagement. In fact, they attended my group last month to update on a few things regarding the revamp of the Mental Health Act. But there's other things they do. The state of care, which is out just now. Key findings. The CQC actually published annual reports consistently highlighting inequalities faced by racial and ethnic minorities in accessing and receiving healthcare. Mental health care, big one for the CQC, as pointed out that Black and other ethnic minority groups are more likely to be subjected to compulsory mental health treatment and face challenges in accessing early support. So this leads to discrimination, communication barriers. The report noted that language barriers, cultural misunderstandings, and institutional racism contribute to poorer health experiences for ethnic minorities. It also observed that ethnic minority patients are more likely to report negative experiences when dealing with healthcare providers. So just out now, and looking through this, I thought, okay, if they're doing annual reports, what have they got out now? And it still is an area of concern. Black men's mental health is still a massive area of concern for the CQC. I think we're sort of halfway. This is Race Equality Foundation. I'm doing a few things with them at the moment. Some work that's coming out. Not to say that's not some other stuff. And again, they visited a group that I run last month with this video. I'll try and put the blog post on the update regarding the things that they're working on. So their key findings, actually, this organization has published several studies and reviews highlighting the experiences of ethnic minorities in the NHS. They found that in regards to poor health outcomes, the foundation's work shows that people from ethnic minority backgrounds are more likely to report poorer health outcomes, delayed diagnosis, and negative experiences within NHS services, particularly in areas, again, mental health. And remember, at the start of this lecture, a lot of the background that I focus on is mental health, even though it's from the carer's aspect. But the term in regards to what I'm linked to is mental health, its impacts, not only on the patient, but the family. So areas like mental health and chronic disease management, again, it's the same thing. language and cultural barriers. The Foundation's research highlights how language barriers and a lack of culturality or culturally appropriate services lead to worse health conditions for ethnic minorities. For example, older ethnic minority populations, particularly South Asian and African Caribbean groups, report difficulty accessing dementia care services. We now move on to the NHS. So this is the Workforce Race Equality Standard and their reports. So the Workforce Race Equality Standard focuses on experiences of NHS staff from ethnic minority backgrounds, but sheds light on broader systematic racism in the NHS. So it's not just patients and their loved ones trying to support them. It's what's happening within the NHS. And as you can see, discrimination among NHS staff. Well, what this led to is ethnic minority staff, particularly Black and South Asian healthcare professionals, report higher levels of discrimination, harassment, and bullying compared to their white counterparts, the white colleagues. This in turn can affect the quality of care provided to patients and those that are trying to support them, that being carers or caregivers. So the impact on patient care, well, the Work Race Equality Standard reports suggest that discriminatory treatment of ethnic minority staff may be linked to poorer outcomes of ethnic minority patients. For example, studies have shown that staff who experience racism are less engaged and is able to deliver high quality care, which is what we need in the NHS. Because if there's a lot of minority groups working in the NHS and they're put off regarding these practices, it's going to impact the NHS again and again and again, and there needs to be a closer look at these practices. Move on to NICE, which is the National Institute for Health and Care Excellence. Key findings of NICE, which provides guidelines for healthcare, has acknowledged again that ethnic minorities face high risks of certain health conditions and barriers in accessing services. Chronic conditions. So ethnic minorities are disproportionately affected by chronic diseases such as diabetes, hypertension, heart disease, which are often diagnosed late or poorly managed in these populations. Access to preventative care. So NICE has highlighted that Black and Asian communities are less likely to access preventative care and screening services, leading to late-stage diagnosis of serious conditions like cancer. One of the things I tend to raise awareness and have a national group on cancer caregivers is this thing, which is why one of the things I pointed out, access to preventative care. Here's the last one, and again, a lot of support from the King's Fund. They sometimes come to the groups that I run and update again on health inequalities, not just ethnic, but across the board. But in this one, I focused on ethnic health inequalities. So what are their key findings? Well, the King Fund, an independent think tank, has published extensive research on persistent health inequalities among ethnic minorities in the UK. Barriers to access, they emphasize the role of institutional racism. There is again socioeconomic deprivation and lack of culturally sensitive services in perpetrating health disparities. Mental health services. The King's Fund research also highlights disproportionate use of crisis-based mental health interventions for ethnic minority patients, reflecting a lack of early support and community-based care options. So let's sum this all up. What does this all mean? And why am I, sort of showing these reports again and again? These are big hitters when it comes to looking at the nation as a whole. And I've not even put the others in there. Reports and studies from organizations such as the NHS, Race Health and Observatory, Public Health England, and the CQC all provide robust evidence of health inequalities experienced by ethnic minorities within the NHS. These inequalities are shaped by a range of factors, including institutional racism, social economic disparities, cultural barriers, and I've put in bold discrimination in healthcare settings. The documented disparities in mental health care, I'll put that first. Maternity services, chronic disease management, and overall access to healthcare underscore the urgent need for systematic reforms to ensure equitable health outcomes for all. But will these reports make a difference? Well, the proof is in the pudding. I'd like to say, if you like this video, give it a like. It really helps spread awareness, especially when it comes to YouTube. And I will be trying to do more videos. Obviously, the focus on unpaid carers and carers, but every so often, I will certainly focus on disparities, minorities, mental health. So if you can, please subscribe. I'd like to say thanks for watching, and I'll see you again soon.